My name is Chris Neuenfeldt, and today we're going to talk about the theory behind a therapeutic technique called EMDR. Eye movement desensitization and reprocessing, or EMDR, is a therapeutic style that has been demonstrated effective in treatment of a variety of psychological conditions, including trauma, depression, anxiety, and addiction. I was trained in EMDR in 2011 according to the EMDRIA, or the EMDR International Association guidelines, and I have successfully worked with numerous individuals since then. EMDR is thought to work according to the adaptive information processing theory, which states that traumatic memories are not processed at a vital part of our brains known as the amygdala. The amygdala, if you wanted to know where it was in your brain, if you were to just take a part of your brain and just go and pop it out, there's a part of your brain that's probably about the size of your fingernail, and you've got one on either side, and that would be the amygdala. The amygdala is responsible essentially for the emotional hashtags that go along with all of our memories. So, for example, if there was a memory of, say, your first birthday, or probably wouldn't remember your first birthday, but your 5th birthday, and that was a really happy memory, the amygdala would put those hashtags, hashtag happy, hashtag childhood, and it would the amygdala would store those memories, or would process those memories accordingly. In traumatic memories, unfortunately, the amygdala kind of becomes overwhelmed. It's not sure which hashtags to apply to a traumatic memory, because traumatic memories, by their very definition, are outside of our normal experience. So the amygdala becomes overwhelmed and isn't able to assign those emotional labels or emotional hashtags to traumatic memories. In combination with the amygdala being overwhelmed, the amygdala's sort of partner in memory processing, the other part of your finger, remember when you pop your amygdala out of your brain, the amygdala is kind of the tip or the fingernail. The other part is the hippocampus. They called it the hippocampus, I suppose, because someone thought that it looked like the back of a hippopotamus coming out of water. I'm not sure if I believe that, but that's what they say. The hippocampus is the librarian in your brain, and in the library, everything is arranged according to the hashtags that are applied by the amygdala. So when the hippocampus, or the librarian, gets these traumatic memories that unfortunately don't have the correct hashtags or any emotional labels attached to them, the hippocampus doesn't exactly know what to do, so it kind of gets frozen up in a way. What this dysfunction does, unfortunately, is it leads to some of the characteristic symptoms of post-traumatic stress disorder, which is often experienced by survivors of trauma. Some of those symptoms include intrusive thoughts or flashbacks, and also nightmares. And what we think, according to the adaptive information processing model, is that those intrusive thoughts or those nightmares are a result of unprocessed emotional content and traumatic memories that haven't been sort of filed away properly. That's where EMDR comes in. EMDR and its characteristic bilateral stimulation operate on the parts of the brain most affected by trauma, the amygdala and the hippocampus. By first developing the internal resources that you need to cope with and process a traumatic memory, you will actually gain the confidence needed to address your trauma history. So EMDR starts in a very, very safe manner by developing those internal resources, or those internal coping skills, and then eventually we, in a guided and progressive manner, walk through your trauma history or traumatic memories that you want to address, and we are able to desensitize, which is the D in EMDR, and we are able to reprocess, which is the R in EMDR, your trauma history or your traumatic memories. And by developing those new meanings and desensitizing the emotional overload inherent in a trauma, you will gain a freedom from your past that you deserve. EMDR is a safe and highly effective approach to treatment, especially of trauma, that has changed the lives of millions of survivors. Please contact me today to schedule an EMDR session.